Hello, I'm Susie Cooper and I'm examining Mike here for pain around the hip for the purposes of the diploma. How are you today, Mike?
Very good, thank you.
Good. Have you got any pain at all in your back or around your hips at all, or legs? No, good. First thing I like to do first when we're examining for anything around the hip would be to ask Mike to walk. So if I can just ask you to walk briefly up and down there. Good. And if I can ask you to stand still. So I'm looking at Mike for any obvious asymmetry, looking at his knees. Is there anything that the hips could be doing that would impact upon the knees or vice versa? Genu valgus or varum. Asymmetry of how he's standing. An obvious asymmetry of how he's standing there. And also if I ask you to turn around, Mike, if there's asymmetry at all. We look at the skin dimples, level of S2, and they are level, as is that of the iliac crest. While he's standing there, I'm going to ask him to start by looking at the lumbar spine. So if I can turn you around again, Mike, I'm going to look at the movements of the lumbar spine. Ideally, really, it's better done with him sitting on the couch, but actually for the purposes of time for now, we'll look at it here. So lock the knees for me and bend over as if to touch your toes, please, Mike. Looking at the whole of the spine, is there asymmetry? He's got a fair range of movement there. And stand up for me and arch your back backwards, lovely. And then I can ask you to run your left hand down your left leg, good. And your right hand down your right leg. There's no obvious asymmetry or particular concerns there at all. Great. Now I'm going to ask Mike to turn back round again and ask him to perform the Trendelenburg test. So we're checking for the abductors. So if I can ask you to stand on one leg for me, Mike. Obviously one would do it on both sides. This is looking at the abductors of the right hip, and he doesn't have any dropping there at all, so that's good, and we can compare with the other side. But that's fantastic, thank you. So if I ask you to lie down now, Mike, that's fantastic. I'm going to inspect. First of all, I'm looking for any obvious leg length discrepancy. One could go on and measure it using a tape measure from fixed points, anterior superior iliac spine to medial malleolus, for example, and then compare it on the other side. If I was concerned by that, I'm not particularly concerned looking at him here. And I'm obviously looking for differences in the limbs, obviously. I'm looking for any abnormalities of the hips themselves, but it's perfectly symmetrical. So I'm going to go on and palpate around the hip joints here. So I'm feeling initially, we'll do both sides, but for the purposes of this, just unilateral. So I'm feeling for the anterior superior iliac spine, where there's the insertion of sartorius coming over the iliac crest, where organ apophysitis, the lumbar spinal muscles can rip small amounts of bone off the iliac crest, checking for no tenderness, not sore there at all. Then round to the posterior superior iliac spine, and of course the greater trochanter can be palpated there as well, particularly for trochanteric bursitis, but that's probably better done on the lateral side. One would then obviously feel for lymph nodes in the groin, bilaterally obviously, and herniae, for example, and onto the symphysis pubis for suggestion of osteitis pubis as well. The next thing I'm going to do is simply log roll the hip. This is a very simple test, looking for just just to see how smooth the range of movement is. It doesn't tell me how good the range of movement is, but it's a good way to start, and one would compare with both sides. I'm then going to do a straight leg raise, because that will tell me immediately if there's some nerve root impingement. So he's not got any sciatic pain. They're suggestive of nerve root impingement, lumbar spinal nerve root impingement, or sciatic nerve root impingement. A useful thing to do at this point is actually a Thomas test. So I'm going to ask Mike to bring both his knees up towards him, to his chest, and I'll hold this one here. And then if you lower your left leg down and straighten it down onto the couch. And his leg lies perfectly. You can do it the other side as well. This tells me that there's no flexion deformity of the hip there. That's fantastic, thank you. And while I've got this leg, I'm going to actually bring it up into 90 degrees flexion and feel for hamstring tightness, which is quite common really. And as you can see, at about 140 to 50 degrees, his hamstring tightness kicks in there, and one would compare with the other side. So those basic tests are quite helpful already. Now I'm going to feel for the actual range of movement in the hip a little more to see if it's nice and smooth, which in fact it is. and also while I'm here, I'm going to test for potential labral tears by a little more, by palpating in the groin and just moving more forcefully the hip through its range of movements. And in fact, there's no clicking or clunking and no pain at all when I do that. Is there, Mike? No, good. Okay. So one would repeat on the other side. So now looking more specifically at, looking at more specific range of movement, I'm going to bring his hip into flexion and external rotation, internal rotation, and then abduction and adduction, which is good, and he's got a good range of movement there. I'm going to ask him to resist those movements now. So Mike, first of all, can I ask you to bring that leg up straight for me and keep it up there. So this is testing his hamstrings and iliopsoas, and stop me pressing down. Good. And then I'm going to ask him to bend his knee, and I'll do the same, and that isolates just the iliopsoas muscle. And then going to ask him to bring his legs into the middle and stop me. So he is now adducting, and he's going to try to resist that. So he's resisting adduction. So his adductor longus and magnus. And then he's also now going to abduct his legs and stop me, and I'm going to try and stop him. So he's going to resist that. You can bring your legs out to pull them out for me straight. That's it. That's lovely. So he's abducting his gluteals and tens fascia lata are going to be involved there, and that's good. The next thing we need to do is ask him to resist me internally rotating his foot. So if you can internally rotate your leg and stop me and try to continue to do that. So I'm resisting internal rotation. Now the same, he's going to try and externally rotate, and I'm going to try and resist that. So he's got good power in all of those muscle groups. Obviously one would, as I've said, compare to the other side. So he's got a good range of power. There's a few other special tests one can do. If I was particularly concerned about the piriformis, I'm going to put the knee into flexion and adduct it. Is there sore pain there at all, Mike, when I do that? Press it over to there. That would be testing for the piriformis muscle. And now I'm going to ask him to roll onto his side, please. That's lovely. This gives me a further chance, if I was concerned about the greater trochanter, for trochanteric bursitis, and also for the ischial tuberosity, for the insertion of the hamstrings in case there was a tendonitis there. Having done that, I'm now going to move him onto his front. Gives me a chance to look at the back and the buttocks, palpate the buttocks. We've done the ischial tuberosity, palpate the piriformis muscle, and just gently spring on the sacroiliac joints as well. I'm now going to test hip extension. If I can get him to bring up the leg in extension, good, and stop me pushing it down, good. And then that, of course, is testing the hamstrings and the gluteal muscles. But if you wanted, if you can bring it up like that, this just isolates the gluteal muscles by stopping the pressing down. So you've got good power there, again, to come over the other side. So all in all, I've actually tested most things. Just a couple of extra things I wanted to do. If you can roll onto your back, Mike. And I'm going to just tap on the bottom of his feet. This will be a test one would do if you were concerned about stress fractures. So by tapping here, or indeed up on the lateral aspect, if there was a suggestion, any concerns about stress fractures, which is of course important in athletes, one would pain would be elicited there. There's only one other test I haven't done yet, and if we can get you to stand up, Mike, it's testing more, again, the sacroiliac joints and for spondylolysis. And I ask him to stand on one leg for me and arch your back backwards for me. That's called the stalk test, and that tests for sacroiliac joint or spondylolysis. Good, you can stand right. That completes the examination of the hip joint and the lumbar spine. Thank you.
Thank you.